We've spent 2 decades and hundreds of billions of dollars digitizing health records. So, why does it still feel so hard for care teams to actually see the whole patient record?
The future is clearly federated medical records. And so I was trying to
Right.
rebuild Athena to federate its medical record data across all its customers.
Will AI now be the true beneficiary of having access now to this longitudinal record?
100%. The Zeus medical record is so much more informative thanks to Zeus's AI, because now not only do we give you the structured data that we find, not only do we give you all the attachments, we read all the attachments.
If you could go back to the early days when you launched Athena Health and give advice to yourself, what would you tell your earlier self?
Trust people, particularly investors, to be.
Straight Outta Health IT, the mic stays surgical. Christopher Kunney moves vertical, purposeful. Strategist with the vision, breaking every system's cage. Guests unfiltered, flipping chapters every page. Industry talk raw, no sugar, no varnish. From policies to tech, the convo ain't tarnished. Blueprints unfold, the future in the dialogue. Cutting through the static sharp like a monologue. Change makers.
This episode of Straight Outta Health IT is brought to you by WellLink, your trusted partner connecting healthcare organizations, data, and innovation for a healthier community. WellLink helps healthcare providers navigate complex challenges, from analytics and AI to workforce solutions and community health impact. Because at WellLink, we believe when healthcare is connected, everyone thrives. Learn more at welllinkcommunity.com.
Welcome back, everyone, to the award-winning Straight Outta Health IT podcast, the show where we have an unfiltered dialogue about the technology, the policies, the patient advocacy, and the individuals who are actually disrupting healthcare today. Again, I'm your host, and I'm so excited today to have this conversation with this individual who has literally been one of the founders of health technology in this space for over 2+ decades as well too. And now he's ventured off to continue to transform how healthcare is delivered through the use of technology. But before we get started, Tribe, I wanted to kind of start with a couple of questions to kind of lay the foundation for you about today's conversation. First question is, what happens when you build the world's most expensive filing cabinet, hand it to a hospital, and call it innovation? You get a system that really looks, good at storing data, but also really is bad at using it to actually take care of patients. Here's the follow-up question to that. We spent 2 decades and hundreds of billions of dollars digitizing health records. So why does it still feel so hard for care teams to actually see the whole patient record? Right? A lot of it comes down to the systems were not designed initially to do this type of work in the first place, right? In addition to that, our instincts in the industry has really been built around keeping this data away and not accessible to patients as well too. But today we're going to start changing that. This individual I have has made its mission to really turn the industry upside down and provide technologies and systems that will allow a patients and anyone in the care delivery process to actually have access to this data. So today we're going to be talking about data defensiveness, right? Why the EHR was never built to orchestrate care in the first place. And what does it actually look like when we set the data free? And again, now this individual that I'm going to introduce you in just a second knows exactly that problem. He's lived it, and now he has a solution to solve it. So I'm going to tease you just a little bit more, and I'm sure by the end of this, you'll know exactly who I'm talking about. So my guest today really doesn't believe in what's called slow moving, right? He's the founder and CEO of Zus Health, a health data platform built to give providers real-time comprehensive view of every patient's care record historically through a single common patient record, which if you've ever tried to reconcile 3 different EHRs for one patient, you know exactly that's a magic trick. So I'm very interested in the secret sauce he has behind this as well. But before Zeus, you might also know this gentleman founded and ran Athena Health for almost 2 decades. building one of the first cloud-based billing and EMR platforms in the country, a platform that today still powers more than 20% of the US healthcare market. He's also served as an executive chairman of Firefly Health, a pioneer in real-time virtual primary care, and has sat on the board of companies like Innovator, building platform services for population health as well. But what's most interesting is when I did my research on this gentleman and didn't know that he also served as an EMT on the streets of New Orleans and a combat medic in the U.S. Army. So thank you for your service there. And he's also been a management consultant for Booz Allen Hamilton. So this guy is one who's literally held pressure bandages and he's also held spreadsheets. He's picked up a BA from Wesleyan and an MBA from Harvard. And today he calls Cape Elizabeth, what today has perfect weather, according to what he just shared with me a few minutes ago, as his home. So if you haven't figured it out by now, I have the pleasure and distinct honor to have on my show today Mr. Jonathan Bush. Welcome, 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 Jonathan, to Straight Outta Health IT.
Christopher, what an intro. Holy
Hey,
moly.
man, you deserve it,
Thank
brother.
you
You deserve
very
it.
much, brother. This was, I feel like it's my bar mitzvah or something.
Absolutely. Well, you earn every accolade and every positive feedback and positive insights that you have offered to this industry. I've been a big fan of yours, and I'm so excited to have you on the show today. But this is not about me. So we're going to jump right into this and talk about what you've been doing since Athena as well, too. But before we do that, one of the things I do like to do, I read out the resume that people can go out and Google or Chat GPT or whatever and get all the general knowledge about you. But I want the origin story, right? What led you from being, a healthcare professional, a combat medic, a EMT, to now wanting to launch a technology company to provide health data records to clinicians and to patients, and then now doubling down on that and really trying to figure out how we fix the problems with these systems now as well, too. Could you share a little bit of that journey with us?
You kind of captured it. I did love driving an ambulance for the city of New Orleans. First of all, I got to be in
Right,
New Orleans.
right,
Second of all, if you're interested in helping people, there's no shortage. Especially this is pre-Katrina. It was a rough and tumble city. But your leverage was, and you could have a lot of leverage. We were doing about 12 calls in a 12-hour shift. So it was
right.
lickety split.
Constantly.
But
Yeah.
still it's 12, you know?
Right.
And
That's
so
right.
you see all these things that are systematically wrong as you're going call to call, and you're like, "Geez, if we only X or if we only Y, or
Right.
why doesn't everybody
Right.
X?" Why? And so
Exactly.
eventually I got sort of, what if I could build a company to systematically, my first mission was actually to bring certified nurse midwives to maternity care.
I think I
It's a
knew that.
very
Yeah.
powerful model if
Yeah.
Americans could be convinced to use it. You can be pregnant and not sick. Paramedicine is bringing complicated care forward without utilizing the doctor. Vietnam combat medicine,
Absolutely.
bringing up all manner of care forward
Right.
of the hospital, forward of the doctor's office, forward of the doctor, the formula we need wherever you look. So at the time, it was,
Absolutely.
could I take it from the street to the first idea was, could I do what is now called community paramedicine? It's still very rare, but could the ambulance actually not just transport you, but treat you and then leave you? Treat you and treat
Exactly.
you,
What a novel
as opposed to
concept, right?
sending you and sit 6 hours at Charity Hospital to wait to get
Right.
cleared and
We can
and
actually
couldn't
deliver the
get back
care on site, literally deliver the care on site, and you go back at home and,
right.
recover from home right
Right, and
there.
nowadays you got Starlink. I mean, you could have a doctor there if you
Yes.
need them for a second.
Right.
In Maine, where I live, it's a huge opportunity because we're such a rural state.
Sure.
People think they've gone into northern Maine when they get to Portland. There's another 5 hours of driving to get to.
Right.
So there's all kinds of everything we're doing today to take delivery of healthcare to the next level is about essentializing and bringing it forward to a mid-level, bringing
Right.
it forward to a retail clinic, or now bringing it forward
To
to a phone,
closest
to a
device.
bot.
Exactly.
And of course, what that means is the standard for coordinating a care has gone way up. In a world where you thought you were going to get all of the care you ever got from mental health to primary care to deep surgery
Mhm.
at one medical
Right.
center, the need for coordination ended at the walls of the medical center, which the
That's
medical
right.
center liked because they can keep their referrals in, so you had
Sure.
that period where everybody was buying up private practices to make one.
Right.
But now you see so much of the best care happening in a remote, digital first
Exactly.
way. And that can't be captured by one medical center. These are 50
That's
states.
right.
And so
Absolutely.
where we
Plus,
are
the different
today,
systems that are diversified through that continuum of care don't reside in one location either.
boom.
Right.
And so
Right.
my little story about, gee, what, how could we take this EMT experience, extend it, essentialize it, has now
Mhm.
gone to this idea of everywhere, always on, 24/7, nearly
Sure.
free. I mean, nearly costless
Well,
care, but the picks and shovels, the file cabinet to your intro
right.
that you
Right.
need for that is a different one, right? It's
It
a
is.
common patient record that's always on and that doesn't care what system, what front end
That's right.
you're using to get care.
Exactly.
Uh,
And
so
who's delivering that care too, right?
or who's delivering it, right?
Yeah. Yeah.
Because the
Yeah.
way that file cabinet got bought that you describe is they said, well,
Yes.
A, we're going to get some money from Obama or the, whatever the High Tech Act or whatever.
Sure.
But B,
Sure.
we're going to capture our referrals. We're going to capture
That's correct.
revenue, going to be able to raise our prices. That's no longer a playbook. Those prices are
Right.
up.
That's
And
right.
what's happening now is people are grabbing lives or slices of lives, slices of
Sure.
episodes of care that they can do way better. And that
That's right.
suddenly means that that file cabinet that you described needs to be universal. It's
Yes, it
not just
does.
your files in there.
Right.
Every
That's right.
EMR today, you captured it perfect. I've never heard that, but that's it. It's your files. It's not the
Yes.
patient's files.
That's
It's not
right.
everything that happened to that patient. It's
Exactly.
everything that you did to that patient.
That's correct. And people who are putting information in that file are coming from multiple different sources, including yourself in some cases.
That's right. Well, in in
Yeah.
in the new world,
Right.
in the sort of ultimate file cabinet, it's
Right.
everybody's patient's cabinet, but it's everybody's files. That's what Zeus is. It's what I
Hmm.
mean, what it seems to me, and I don't know if this is just me, but uh, when you make it, the first thing you feel is joy, and the second thing you feel is guilt, and then you want to give
Why?
money to everybody else who's trying to make it. So I
Yeah.
own 1,000 slices of little startups all
Sure.
over America since Athena was sold, and all of them have. I'm looking at these board meetings and these, shareholder
Right.
reports. They all have the same problem, which is they're trapped in the wrong. Can't get into the file cabinet. Can't
That's
get the
correct.
rest of other people's files.
Right.
And so they're all
Yes.
building their own file cabinets and
In a
dog's
very
not home.
silo environment.
That's right.
Exactly.
So
So
I
so that
realized if I'm gonna save all my angel investments, I better hurry up and get a
you
working
gotta
file
connect all
cabinet for
these
these
together.
people.
That's right. Absolutely. I gotta
And
create the
that's
highway
Zeus.
for 'em.
Zeus is the first fully functioning, always on, comprehensive,
Sure.
API first, common patient record. It's not the
Absolutely.
first try. God, we've heard
Yes.
about.
Yes.
Remember
Right. Right.
back in the day when we were boys, there was Health Vault. Remember
Hmm.
Microsoft announced problem
That's
solved,
correct.
mic dropped. We all
That's
can
right.
just get on Health Vault. I haven't seen a Health Vault in a while.
It's about timing too, to a lot,
That's
to
right.
much of an extent, right? And so from your journey, you and your colleagues really led us into the cloud computing age in healthcare, right? Because you were one of the first
Oh,
companies to truly create a cloud native platform that
oh,
allowed us now to get out of this, siloed environment where we
on-prem,
were
right.
on-prem. Yeah, exactly. Minimal access, firewall that will put them behind a moat and nobody else going to get access to it, but the people who are within that system. You shifted the paradigm completely for the industry and it
Yeah.
really
It's
transformed
funny,
us.
we almost started too early because people are like, "I can't
Yeah.
use like this internet. I can't trust my
Right.
data to the internet." For the
Right.
first 5 years of Athena's life, we
Yeah.
almost died because we were trying to hide the word. Well, it's a shared
Mhm.
server. It's not the internet. I mean, it was
Yeah.
totally the internet.
You can call it the internet or you just call it an easier way to
Yeah,
get
and in the
access.
end, it was like tailwinds.
I want to delve into just, where you are now. You evolve, so you help launch and transform the industry through the use of, technologies like Athena Health, and you created a cloud strategy for access to clinical data. Now we're moving to this whole concept around data defensiveness, and you kind of coined that term. Talk to the tribe a little bit. I call my listeners the tribe.
Yes.
The tribe a little bit.
Hello, tribe. Thanks for having me.
We're happy to have you. Who haven't heard this term, data defensiveness.
Yeah.
What does it actually mean and why is it an enemy of value-based care?
With those early McKinsey studies, I'm sure you saw one in your boardroom
Right,
back in the day,
right,
part of the justification for buying $1 billion closed EMR was that you would keep referrals into
right.
your world because, hey, data is fully coordinated and shared if you
That's
stay in
right.
your world. But if you use the lower cost imaging center across the street, oh, we don't have coordination of care anymore. So
Exactly.
that playbook was what justified a lot of the early EMR investments, as well as government
Sure.
subsidy and the ability to drive up your codes by capturing
That's
more
right.
click, more
Right.
findings. Today,
And
the
a fee
money
for
is being
service
made on
model.
the other
Right.
side. People talk about TME, total medical
Mhm.
expenditure. Can I drive down TME and keep some of
Right.
the savings? In
Exactly.
that world, you need sort of the opposite. Now, the guy who's the way you're going to make that money, the ox that's getting gored here,
Right.
is that somebody's going to eliminate a hospital day by doing virtual care or by doing
Right.
better micro dosing of drugs or by using a community based, surgery center instead of a hospital.
Sure. Sure.
So now that hospital, I mean, hospitals are run
Uh,
by good people most of the
Right.
time,
Right. Right.
almost all the time, but they do lose money by sharing data. So they get puckered up about all
Right.
these
Right. It's a
people hitting their
double-edged sword.
server and saying,
Yes.
"Hey, I'm going to see this person, and I'm going to see this person, and I'm going to see this person." And you
Sure.
can see Epic engaged in lawsuits and other states' attorney general being turned on this
Sure.
on both sides of it
Right. Right.
because it's going to be a lot of compute that hospital bought
Right. Right.
that it's
Absolutely.
unpaid for. It's unfunded
That's
mandate
right.
that they share all this data. But secondly, they might lose some referrals. They might lose some
Right.
revenue.
I'm just to interrupt you just for a sec, but fee for service only works if the fee is actually profitable, right?
That's
It-
that's right. We're sort of in the not the infancy, but maybe the early adolescence of the fee for not service. If
Value-based care.
Firefly, you mentioned I used to be on the board of Firefly. Their numbers, when they put up their numbers with a customer, it's the reduction in emergency room visits
That's
that they
correct.
celebrate, the
Right.
reduction in hospital days per thousand lives. The number of visits to the doctor goes up tenfold, but they're little
Right.
tiny 2-minute virtual visits, right? But the
Absolutely.
hospital days are dropping. If now the data on those patients is mostly owned by hospital systems in one way or another.
Sure.
So the hospital systems say, now you want me to give me all the data to enable you to keep people from my store.
Not only that, too, to your point, I mean, because it truly is capitation, right? At the end of the day, it's really how do I identify the sickest patients that I do need to focus on
You bet.
that are driving up the cost of care versus all the other ones that are paying for that,
Yep.
right? How do we start to normalize that in some form or fashion so that we do remain profitable?
Carl Byers, who you should have on this, the F prime venture
Sure.
capitalist, he wrote an article called The Fourth D that in
Right.
all of our early careers, the money was made by either, the doctor groups, the
Right.
drug groups, or the devices. Those were the sort of areas you'd invest. And now there's
Exactly.
this fourth D, which is the data,
Right.
because in fact, if
That's
you
right.
get a close enough bead on a patient, you can know when they're about to hit the hospital. This
Absolutely.
idea of a rising risk indicator.
That's
Here it
correct.
comes. And so suddenly this fourth D, this data industry becomes about early signal. What can you see? How early can you see something that
Sure.
is a leading indicator of a big medical bad day for the patient, but also
That's
a
correct.
big expense? The more you can see, the sooner you can see it, the more likely
Absolutely.
you are to get out and stop it from happening,
That's right.
which becomes then your money event is the thing, it's the dog that didn't bark. It's
That's
the
right.
money, it's the event that was prevented. In the end, I do believe those who are seeking to reduce the harm of the healthcare system are on the right side of history. Business models are
Absolutely.
moving that way. You are starting to be able to make real money doing that. And the hospitals that started defensive will say, no, I'm not going to block. I mean,
Right.
it's
At the
not
end of the
right.
day, it's still your mission to take care of the populations within your community as best you can, right? And
Absolutely.
it's a business, no money, no mission. So you got to figure out the delicate balance between making sure I'm accessible to all groups within my community, but also doing that in the most effective way
You
so I
did
can
say
stay
profitable. Like,
operational.
look, there's a lot of banks that are the leading. I mean, the bank
That's
machine, the
right.
little teller was going to kill the
That's right.
bank, right?
That's
And a
right.
bunch of banks said, let's go in deep, right? And,
Mhm.
Chase, you can see these machines
That's
everywhere.
right. And
And
what's
you
the
don't need to
benefit
be a
for
Chase patient
to
to
get access?
a Chase member to get access to
Right.
those machines. They get a couple of bucks on the back end, whatever. You could see that happening here. There's no reason that hospital systems couldn't say, all right, stop guarding our hospital days and our in-hospital surgeries like they're the holy grail. Let's go after the lives and let's
That's
make the
right.
savings our mission too. If
Absolutely.
they don't, they're going to die. I do think, history's going down the road of managing care as an ongoing 24/7, always on event, not a once in a lifetime break fix thing.
That's right.
Uh,
I completely get it. And another topic for another day. Let's not get into the concept of the silver tsunami, right? Every day, 10,000 people are turning 65 for the next 20 something years. Well, 40% of the doctor's patients are going to be over 65 in the next 5, 6 years, and even more so. And we don't have enough young people to take care
right.
of them. So
Don't worry about having your hospital be empty if you cut your hospital days per thousand. There'll be something in there.
that's right. It is going to be somebody in there. And 9 times out of 10, they're going to have two or more chronic diseases they're dealing with as well.
You
Yeah, which
bet.
is a whole nother topic. I want to, jump further into the conversation as well. So when we think about what we just talked about, we built, a industry and technologies on a model that's really obsolete, right? I mean, truth be
Yep.
told, it's not sustainable anymore. We know that healthcare is what, almost 18, 19% of GDP. If it hits 20 plus or more, it's almost unsustainable. No one's going to be able to afford it, even corporations subsidizing their employees. So we got to figure out how to drive that cost down. I want to talk about how Zeus Health, with this longitudinal record strategy, right, and access to that data wherever you are, helps to address that problem. So when you were sitting around one day after you sold Athena Health and you figure out what's the next thing, I'm still too young to just go to Maine and
Right.
and not get up every day and have purpose in life. You saw this as a gap. Talk to us about how this happened, why you decided to attack this, and where you see the industry going now that you've built this solution.
I got booted and it got sold.
Now,
So the
understand,
first thing I did
you know, right?
was drink and feel
An
sorry
interview
for
for another
myself.
day.
But yeah, so as a good friend of mine who's a venture capitalist said, you need to shave. You need to take off your bathrobe and do
Right,
something meaningful. Stop being a
right,
baby. And what homework did you not finish? The dog eats your homework. You got to write a better paper. And it was really that, because I had been trying to, Athena made most of its bones on the fact that it had federated all the insurance rules.
sure,
If you got a denial, I've asked the five whys, I figured out what that rule was. And then nobody in any medical group ever got that particular denial from that particular payer again. So it was this
right,
federated knowledge network. But the
exactly,
medical records weren't federated. We were all racing to meet the High Tech Act definition of an EMR, meaningful use.
right,
None of that was included. So we dropped it. The future is clearly federated medical records. And so I was trying to
right,
rebuild Athena to federate its medical record data across all its customers. Because
sure,
the day I left Athena, I think we were on a rate of 2 million faxes a month from one Athena customer to another. They're all in the same system, but they're faxing each other medical records.
it's
Holy
insane.
cow.
Yeah, exactly.
So that was the idea. And as I said earlier in this call, most of my investments since leaving Athena were somehow related to modernizing medicine, some kind of digital
Right,
first, more always on way of reducing cost of care. And all
mhm,
of them, the picks and shovels were missing. To your point, the EMR and all of the technology built was based on fee-for-service medicine claims. Even the EMR encounter was really the way
sure,
they sold it before the subsidy was, hey, we'll get you to make it easy to basically bill a higher code. And what was needed was sort of the opposite, was just the essential truth of the record, not bloated up with unnecessary clicks, but always
exactly.
on,
Oh,
knowing whether
sure,
it happened here or somewhere else or at a pharmacy or at an imaging center or
right,
you're at a golf game and some guy says, oh, this cardiologist is the greatest. And you make an
yes,
appointment there. Knowing that becomes the key to the next generation of improvement on the
right,
delivery side. Obviously, on meds, the GLPs, there's so much going on
sure,
to get at the root drivers of the chronic diseases that you talked about. But on the delivery side, that was the mandate, and all the money in an R&D had gone in the wrong direction. It had gone
mhm,
to sort of capturing one moment, not
right, right,
capturing the thread of moments. And
exactly,
so, we decided, and the venture capital community, because I'd kind of returned a lot of money to Zeus and Athena investors, gave me a lot of money. I'd be able to spend,
sure,
50, $80 million building a really reliable, always on common patient record. And the key to it, when you're going from a world where nobody knows anything to where everybody has to
right,
trust everybody else's work, is provenance, is knowing who this says you have cancer. Who made that finding? When? Where? On what evidence? So
exactly,
seeing all of this origin story behind this new
Sure.
complete picture of a patient was a big investment for Zeus, making it something that doctors would actually trust or know to not
Sure.
trust based on that provenance was a huge revenueless march through the desert to get that
Right.
working.
What were the obstacles then? I mean, because obviously you're really trying to turn this on its head, right? In
Yeah.
terms of the
We
conventional
have,
way of
I mean,
thinking.
there's
Right.
no
What
legal
were the
framework for this. The customer contract had to be different because
Sure.
you're not buying a patient record, you're buying a membership in a common patient record, but you
Right.
still have privacy and security obligations. So figuring that whole thing out and then
Exactly.
figuring out this provenance problem, saying, here's all this data that we just found. How much of it do you want to include as
That's
yours? How
right.
much of it do you
Right.
want to say, you know what, I don't believe or don't need that? So
Mhm.
building the playground was a
Sandbox.
big
Yeah,
project, right? And
that's right.
then, whether you graze your cows on that common or not is up to you, but the
Mhm.
common, getting everyone to accept that this is the common was a huge
Sure.
piece. And then getting the early customers to uh
Right.
to let go of the idea that they're going to have Precious, that Precious is going to be the
Mhm.
ring to rule them all,
Exactly.
and
Right.
no one's going to be allowed to see Precious
Right.
except me. Yeah,
Right.
it's like, dude, you're not gonna first of all, you won't get Precious. Second of all,
Absolutely.
they're gonna see it anyway. You
That's
know,
right.
so stop wasting your time
Right.
and money trying to what did you call it? Data defensiveness.
Mhm.
So that was the second wave, and it took a lot of work to get the early customers to try. And then the third thing was, how do you even though everybody knows quality of care is better and everybody knows that ultimately in a capitated world, um, the lower cost providers will win. How do you get the early people to make money on that when really we're not really totally capitated yet today?
Right,
We're
right,
still in
right.
these
Yeah, far
ACO
from it.
contracts where it's not. So
Absolutely.
the early days was finding those people with leading edge brains and souls, but also leading edge business models
Mhm.
that would make money actually knowing the truth about a patient as early as possible.
And can we now show true ROI in a capitated model, leveraging, this platform?
You can, but it's anecdotal still. It's
Okay,
not
okay.
real-time
I
flow. It's not
appreciate the
like
honest
Days and
answer too.
AR at Athena.
Yeah.
Yeah. I
No, I
mean,
appreciate the
one of
honest
the
answer,
things
yeah.
that we struggle with is, it's still one of these, I know it when I see it. Everything runs better, but what number did I move? In
Sure.
the end, you can imagine every single thing you do, pre-cert, pre-auth, referral,
Right, right.
transitions of care. If you actually have the whole record without, having to start from
Mhm.
scratch each time, all those things go better, right? All
Absolutely.
those things are dramatically faster.
Yeah.
But showing it in the numbers as you are moving to
Mhm.
that world, when you still have your old record and this new record, that's the
Right.
dance that we're in today.
And to some degree, isn't it just the cost of doing business now, right?
I don't know what
Right,
day it's not today. People can still
right,
say, "Look, I'd just rather give them a clipboard and do hope for the best."
right,
But
right.
in the end, the idea that you would, for $1, be able to know someone's entire history and choose not to,
I'm just
well,
curious also, as we look at LLMs and now the emergence of AI, will AI now be the true beneficiary of having access now to this longitude record?
100%. And
Yeah.
it goes both ways. So
Yeah.
the Zeus medical record is so much more informative thanks to Zeus's AI because now not only do we give you the structured data that we find, not only do we give you all the attachments, we read all the attachments. And we
Right,
look
right,
at this,
right.
Atlas AI, which is going through that
Yes,
we built and finding clinically relevant facts for you, the oncologist, that the dermatologist may not want to see, but there may be
that's
other
right.
facts in the narrative that we bring forward for the dermatologist. We couldn't have
Exactly.
done that without an AI agent that we could train,
That's right.
to do that. And then, of course, many of the users, the end
Yes,
doctor is actually an AI that's
that's right.
talking all the time to patients rather than, getting a text and then
That,
waiting
that,
for the doctor
that
to get the
that's
record right
correct.
back. The
You-
the doctor can be the supervisor of these always on agents that are
Sure.
talking as opposed to be the agent themselves, the meat bot, as they
Yeah,
say.
right, right, right.
The
I
doctors
like
don't
that
wanna
meat
be
box.
meat bots. That's not
Absolutely. And
me.
then you reduce that cognitive workload on the doctors and nurses and healthcare professionals, and and then this becomes a true tool to provide insights for them.
There's no obvious pathway here. You should look at
That's
this
right.
yourself, use your judgment. Or this patient doesn't respond to our advice. Maybe you should talk them into it. Maybe there's a
That's
moment
right.
for a human sales event, which, true
Absolutely.
primary care doctors are really good salesmen. They talk you
Hmm.
into doing the things that you might not otherwise have done,
That's correct.
educate you and inspire you that it's worth it. So
Absolutely.
there's still
But we
those
trust the
needs for
white coat.
doctors.
Yeah, we
100%.
trust the white coat. Yeah, without a doubt. So tell me, what does good look like when data actually is accessible And what changes for the patient and the provider and the whole system when you actually can envision that? But fast forward X number of years, whether it's
Yep.
3, 5, whatever it is, and this is now mainstream into our healthcare ecosystem. What does that mean for us now?
Well, I think it's funny because people talk about, oh, there's so much healthcare data. And I'm like, ladies and gentlemen, we are nowhere near how much data there is.
Right,
Because,
right.
we look at the procedure codes. Behind those
Mhm.
procedure codes, there's some encounter notes in the EMR. But behind
Sure.
the encounter notes was 3 weeks of discomfort happening
That's
all
right.
day long, right? And then between the two is a 12-minute conversation between the doctor and the patient. None of that
That's right.
data is anywhere, but now it
Right.
is. Right now, the AI is listening to the conversation. All that
Yes.
subtlety is now part of the data lake, right?
Mhm.
And really, as people get Whoops and Fitbits and intelligent drugs, all
Yes.
those 3 weeks of discomfort will be part of the
That's right.
conversation. So
And then
how
how do
do
we do forensics on the back end, right? To, and
you
to now
you'll know,
understand
right?
what caused the issue so that we can prevent it for future patients as well.
You said, "What does good look like?" I like that because there's great, but there's good. Like
Mm.
today, a hospital encounter we know about in sort of 0.85 days, but any
Sure.
encounter of any kind, we on average are 7 or 8 days till we know about it and update
That's
the
right.
Zeus record. So
That's
obviously we
right.
should know about it
Well,
when an appointment
yeah.
is made or an eligibility is checked. That's a grab that Zeus will do in the coming year so that you'll know that the days of lag between when something is
Mhm.
true and when Zeus knows it will be zero. But then
Exactly.
that's how to get to good. How to get
Sure.
to great
Mhm.
is to know about it before they go to the doctor.
That's
Why
right.
did they make that appointment? Have they not slept 4 days in a row? And are
Sure.
they on an Aura ring? And have they given
Yes.
permission? And if so,
Right.
we're gonna call them before they ever make the appointment.
That's what I'm saying. The care bot now, or the technology algorithm, is warning the patient that, hey, we need to see you. We see some anomalies
That's right.
happening that you're not even realizing are going on in your
That's
own
right.
body,
Or
and we
to the
need to
earlier part
respond
of our
to it.
conversation, we're gonna send someone to your house.
That's more to
One
your
of our
point.
biggest
Yes.
customers is Sprinter. They're taking reams and reams of
Sure.
high cost, high RVU care and turning it
Right.
into lower cost, much more intimate care in the home. That's
Exactly.
a huge playbook that hasn't begun
Absolutely.
to be really played out.
We talk a lot about social determinants of health. We even talk a little bit about digital determinants of health. I'm curious from your perspective, there's a concept that Dr. Daniel Dawes presented called political determinants of health. And not to get too far into politics or anything like that, but that does impact our ability, right, to innovate, you know, drive change. I'm curious, what policies would you like to see enacted, double down on, eliminated, that slowing the progress of adoption down for a Zeus Health?
I thought we were going a totally different place there. In the
Well,
Zeus
we can go wherever
envelope,
you want to
we'll
take it.
go there
Yeah.
too if you want. Yeah. Yeah. Zeus is, we talked about data defensiveness. Obviously, those who have spent billions building moats around their data and they
Right,
think of it as their data, they don't think of it as the
right.
patient's data, don't want to lightly let go of it, don't want to lightly integrate it into a larger picture. Um,
Sure.
and so, you're going to have some that are going to fight it, and you have others that are going to sort of slow roll it, which is very common
Right.
in medicine, sort of
Exactly.
Hippocratic oath gone wild.
Right, right, right.
There are lawsuits and committee work and rule making arguments going on in Washington right now over
Yes.
what is defined as a treatment use case. You're not, so for example, if a patient wants their data, it's
Right.
completely covered under HIPAA for the patient to have the data, but there's no penalty if a hospital refuses to share it electronically
Interesting.
with a patient. They say, go to our portal and you can copy it,
Sure.
paste it, or
Right.
print it, but they're not required legally. They're allowed, but not required legally to share that. There's a lot going on now to say, oh,
Yeah. To make it
let the people
easier
have
for
the
the
data.
patient. That's
Well,
right. Yeah.
there, but even within the treatment use case, like what counts as treatment? We were just talking
Right.
about agents, AI agents.
That's
Are
right.
they doctors? Today there actually has to be a person with a NPI number and the ability to be sued
Right,
that is
right.
standing behind the request for data under a treatment use case. It's fine with
Yes.
me. That's a tussle. That's political. Everybody talks about data being liberated is good, but then when you get right down to it, some people have an ox that's gored if it goes too quickly,
Yeah,
and so
yeah.
that political, will data sharing end all of a sudden, be shut off? Will the dark forces win? Yeah, probably not. Uh,
Right, right.
will we go all the way to unlimited individual access like we can with weather data when, back in the
Sure.
day when Reagan told all the NOAA weather buoys, you can share your data with anyone, not just our one
Right, right.
forecaster? Maybe not yet. Maybe we'll go
No,
slower than
no.
people
But
think.
but more like the banking model to your point earlier, and that is I can go to Chase. I may not be banking at Chase, but I can still go there and do some basic
Yeah.
transactions.
That is exactly what I think will happen, is
Right.
that the data liberation will occur among providers, that will
Mhm.
survive. That
Yes.
the providers who try to stop other providers, even digital first providers from getting care, will lose,
Mhm.
and they'll have to
Yes.
share the data. And some of their
Right.
systems will break, and then an Epic will have to come up with a better server for sharing this
Sure.
stuff and blah, blah, blah. But in the end, that's my bet, is that
Right.
the politics will end with those. And then it's a little bit like the camel's nose in the tent. Now all these
Mhm.
digital providers have the data, have a feed on
Right.
everything that's happening. They then may turn around and build a wider range of consumer facing apps. And then one of
Exactly.
them will someday open their API for anybody's Fitbit or
Sure.
Ring or Whoop or whatever to get the data as well. That's the
Absolutely.
path I imagine the politics flowing.
I'm curious too, and this may be a little bit of a loaded question. Feel free to,
Hey
answer it
man, we're
wherever
trying
we
to get
want.
viewers. Let's load these
Yeah,
questions.
I know, right? And hey, I love it. I'm glad you said that. I call it straight out of health IT for a reason. How about the EHR vendors? I mean, are they catalysts or a roadblock to making this vision a reality?
Whether you're a catalyst or a roadblock towards the innovation of EHRs is a function of whether you've figured out a new business plan to grow into.
Right,
If you're still trying to get surface area of the doctor's clicky click on turning the
right,
99213 into a
right,
99215,
right.
you a dinosaur. There'll be the private equity roll-ups that take those and
Sure.
milk them for as long as they can. That's already
Right.
happening. Thoma
Yes.
Bravo bought NextGen and they're just,
Hmm.
milking it. If you have the capital and the investor permission to invest, you could
Hmm.
lean forward. And I think you're
Right,
witnessing a lot of turmoil now at Epic. I think there's
right.
probably two schools of thought. They've lost a lot of
Yes,
leadership recently. I don't know
yes.
exactly why, but they're not gaining any more hospital systems. I mean, they're
Well,
nine
that's
more
the point. Not in
great,
the US anyway, for
right?
sure.
So
Yeah,
they,
I mean,
go out and get the nation states. To me, they have a question, which is, are we an information company or are we a hospital products company? And if we're an information company, we need to sell products that the hospitals might not like with this data.
sure,
And I
sure.
think they're in a real tussle in their deliberations.
And can you be everything to everybody either? I mean, that's the other
That's the
opportunity
tussle.
challenge question,
You
right?
know, Judy
I mean, or do I
Faulkner was a
stay in my
brilliant
lane?
entrepreneur because she
Right.
chose, right,
Mhm.
wrong, or indifferent. She said, I'm a customer focused hospital software maker,
Right.
and
Right.
I'm going to do software that those hospitals like. And she
Hmm.
built those 35 different, I don't know what they're up to now, systems that
Right.
all wrote to the same mumps database,
Right.
and they
Right.
worked perfectly with each other, but you had to use it exactly the way she said,
That's
and they even
correct.
liked that. The hospital executives
Well,
couldn't
they
get the
were
doctors to
trained.
behave, but Judy
Yeah.
could.
I'm glad we're having a conversation, and Lord knows I need to have you on for part two because we're literally at time. But I do want to go down that path too, and that is what is the future of the EHR, right?
Yeah.
And the evolution of it, going forward. And to your point, I think you're reimagining it, but what you're trying to do as well. But is everyone else down that same path or coming to a realization that this version of the EHR is now at its end of life or should be.
Yeah.
We need to
I
be
do
thinking
I do
about a
think
future
that the
version.
EHR that integrates the
Yeah.
data with the workflow,
Right.
with the compute for every,
Right.
and it's an all you can eat buffet,
Sure.
is over. I think that
Absolutely. Or should it just stay as a
workflow, you can write a
platform?
workflow you can have an
Mhm. Right.
otolaryngology specific EMR written. If you leave out the data in the compute and you're just
Right.
doing the workflow, you can have it in a year, 6 months on, a
Yes.
bunch of AI and a bunch of coders. What I see happening is the provider world will have its own software that it
Right. Right.
writes and maintains. Instead of
That's
having
right.
CIOs, you'll have CTOs. We're talking about
That's
Bradley Dick.
right.
He used to
The
be
chief
the
AI
CIO for
officers.
the ortho group. Now he's writing software,
That's correct.
and as it gets easier to write software, and as platforms like Zeus emerge, the front end workflows they won't be free, but they'll be cheap enough and easy enough that there'll be thousands of them.
That's right. An open architecture platform, it makes it easy for me to
I think
leverage
so.
them, right?
Yeah.
Yeah, there are tools I can plug into applications I'm building. I don't have to go and reinvent the wheel, or I don't have to spend godly amounts of money to get that type of integration into those
That's
technologies. I
my
actually,
thought, is you
yeah,
just start with there become companies like Zeus that have an open API that do what
right.
the documentation says,
That's
and you say,
correct.
"Let's just write this on Zeus." We've got 2,
Right.
3 customers now that have EMRs. They have their own CRM that they've built.
Mhm.
They have Zeus, and then they have an
Right.
EMR of record.
Yes.
But as they look at the surface area, they're adding more and more to the CRM that they've built because they control
That's
it, they
right.
can change it any way they want, and they're using their EMR less and less. Now, these are
Exactly.
just the forward leanings, venture backed super dupers.
Sure.
But once the super dupers do it, you could imagine a JV version of that coming
That's
next.
correct.
You know,
Absolutely.
once people start cutting the cord from the old EMR, now those EMR companies can go and build into that new world. It's not that I
Right.
don't think that because that version of EMR dies means the EMR companies we know of die. It
Right.
means that the current business model
Guys.
dies.
Or do they become more like a Salesforce, right? Which is more of a platform, right?
Right.
And then you build on and you let others
They become a
innovate on
sales
top of it.
force, that's right, they can become a
Yeah.
service bureau. They
Yes,
can
yes.
even become we had a plan that we never did, the Athena IPA. And
Right,
what we
right.
were gonna do is we were gonna negotiate really favorable, reasonable contracts with every payer
Yes.
and say to the doctors, "Look, if you wanna just drop the whole
Mhm.
nonsense of you negotiating with your 12 docs going to
Exactly.
Aetna,
Right,
trying to,
right.
you can just sign up for this buffet. All the
Yes.
contracts work perfectly. All the payment are real time. The second you see the
Absolutely.
patient, you're paid, done. And the IPA fee is just your Athena fee plus 5% or 10%.
There you go.
Athena could still do that. If you
Yes.
do it,
Yeah.
Bob, give me a thank you note.
There
Actually,
you
it was
go.
Derek Hedges on my team's idea, but he's dead, so I'll
Right.
take the
You'll take
credit.
the credit.
Uh, but there are things like that that those companies, the Athenas, the Next Gens, the Cerners, are
Yes.
positioned to do where they could
Absolutely.
be even bigger, more successful companies. But
Exactly.
writing shrink wrap workflow software that isn't connected to data, maybe they get so good at it that that Athena turns out 50 EMRs, one
Yeah,
for every
yeah.
specialty. But it can't be this all you can eat buffet of cafeteria food software
Yes.
anymore.
We're at time, but I do want to go to what I call my rapid fire round. First question is, if Zeus Health was a superhero, what is its power?
All seeing.
I like that. I like that. Next question. EHR or EMT bag, which one saves more lives on a given day?
It's all about leverage. The
Mhm,
EMT saves more definitively one life, but you can only get
mhm.
that bag to so many people a day. You write a piece of
Yes.
software, and the whole wide world can use it the next day.
Last question. If you could go back to the early days when you launched Athena Health and give advice to yourself, now that you know the journey, what would you tell your earlier self about, what advice would you give your earlier self?
Trust people, particularly investors, to be animals. Don't
Interesting.
trust what they say. Trust that their
Yeah.
job is to be terrified animals going from water hole to water hole. Don't ask them to be too patient. Don't
Right.
ask them to be too brave. Don't ask them to
Right.
they wanna be patient, they wanna be brave, we all
Sure.
do, but we're all frail animals. You need to balance the foot in the future that you wanna take them to with the foot in
Mhm.
the present that they wanna be at.
That's
And
right. That's
I
right.
think that once things start to work, people start, at least I did, I got naively, idealistically wrapped up that they'd wait for my ideas
Right.
infinitely,
Right.
or tweets it.
Great advice. I think at the end of the day, we have to recognize that, they're in the business of returning, or an ROI to
Yay.
their investors as quickly as possible.
That's right.
That's right. And so they may not always believe in the mission, but they believe in the business model. Yeah, which in the mission can take time because that's a huge
No,
transformation that
you
has
can
to
still
happen.
have your grand mission, but you make
That's
sure you
right.
give them a little today, every
That's
day,
right.
then you quietly,
Right.
lay aside the future. But
Absolutely.
I got hubris. I got convinced that I had convinced them. Every single CEO that I've backed, when things
Yeah.
start to go really, really well,
Yes.
they get it. They
Wonderful.
think it's
Wonderful.
more due to them than it is. They think their customers and their investors are more patient than they are. Some when they get the punch in the nose
Mhm.
respond nicely,
Yes. Yes.
but the punch in the nose is always coming for all of
Absolutely. Like Mike Tyson said, you may have a plan until you're not ringing somebody hits you in the face. Right.
them. Amen.
that things change.
Tyson rule is close second only to the gravity rule.
That's right. Well, that being said, we're gonna have to leave it there. Jonathan, thank you so much for your transparent, and visionary conversation about the state of healthcare in the future that you believe we can get to as well. If someone out here in the tribe is listening and they want to connect with Zeus Health or connect with you in particular, what's the best way for them to reach you? And
Jerry Bush at ZeusHealth.com. Come
there you
on over.
go. Well, thank you so much. This has been absolutely a masterclass on why health data has been stuck and what it takes to unstick it. We should keep our eye on the prize, understand that data is the currency at the end of the day, and it is what will drive true change. And we need to make sure it's accessible to all who can benefit from it as well. That being said, thank you, Tribe, for taking the time to listen in. If you like this episode, and I know I did, let's make it go viral. Tell your friends, families, colleagues, even people you don't care for, because they can benefit from this man's wise experience, visionary, mindset, and hard work that he has done to help transform healthcare today. Until next time, thank you for listening. Stay curious, stay disruptive, and catch you on the next episode.
Right on. Thank you, Christopher.
Thank you, Jonathan. I appreciate your time today.